Good day, dear students. I am Chimidron Sergei Nikolaevich, the head of Human Anatomy Department in Samara State Medical University, and today we'll talk about nervous system, and in details we'll talk about peripheral innervation of head and neck, and we will talk about principles of this innervation, also such somatic and also such autonomic or vegetative innervation, and vegetative features of innervation of head and neck structures. So first let's talk about spinal nerves, and also we'll talk about principles of peripheral nervous system. So you know that there are two parts of nerves, 12 parts of cranial nerves and also 31 parts of spinal nerves. So peripheral nervous system also includes the radiuses. You know that each spinal nerve formed with two radius. First radix is anterior radix and second is posterior radix. Next, peripheral part of nervous system includes also gray structures, gray matter, which called ganglia. You know that ganglia divides in some parts in two main parts. The first part is sensory ganglia, and second part is autonomic nervous ganglia, such are parasympathetic and also sympathetic ganglia. And I repeat that ganglia includes only somas of neurons, neural cells bodies, and that's why they are a part of gray substance, gray matter in peripheral part of nervous system. So next part of peripheral nervous system are nervous plexuses, and we will talk in details on this lecture only about cervical plexus, and after the next several lectures we will talk about brachial plexus, lumbar plexus, sacral plexus, and also some words we will talk about coccygeal plexus. So all these plexuses are somatic peripheral plexuses in peripheral nervous system. And also not only somatic plexuses are situated in our body, also we will talk about autonomic or vegetative plexuses, such are, for example, solar plexus or celiac plexus and each others. Next, nerve receptors. So on histology you will talk in details about parts of morphology of peripheral nervous trunks, and you may see the main structures of peripheral nervous system. You may see, for example, peripheral trunk, and you may see the construction of this structure. You may see the axons, the central nervous root, and also you may see the myelin cell or Schwann cell which cover this axon. So you may see endoneurium. This is a part of connective tissue which covered several axons, and they cover myelin cells. And some of parts of these trunks, little trunks, inside this big trunk are covered with perineurium. You may see connective tissue inside this part, and also all the trunk is covered with epinevrium. This is count of neural trunk. Also, we will talk in details now about spinal nerves, and you may see the spinal nerve here. Spinal nerves are located in regular order neuromeres corresponding to the myotomes or myomers of the trunk and alternate with a segment of the spine. Every nerve is attended by a corresponding area of skin, dermatome. So we have 31 pairs of spinal nerves, 8 pairs of cervical, 12 pairs of thoracic, 5 pairs of lumbar, 5 pairs of sacral, and 1 pair of coccygeal nerves. Every spinal nerve branch formed from spinal cord in 2 roots, dorsal and anterior. You may see dorsal or posterior root here, and also you may see the anterior root, and 2 of these roots on this picture form spinal nerve. So this nerve is formed in intervertebral foramen. Near this foramen, in posterior root, is situated ganglion spinale, which contained the somas of sensitive neurons or bodies of sensitive neurons. You know that these neurons in morphologic structure are pseudo-unipolaric neurons. So let's talk in details about branch of spinal nerve. Posterior dorsal branch is for the autochthonous muscles of the back, developing for dorsal part of myotome and the skin covering in. Anterior ventral branch for ventral wall of the trunk and for the limbs, developing for the ventral parts of the myotomes. Next, communicans branch to the sympathetic trunk of autonomic nervous system for innervating internal organs. For example, you may see intestine. And also meningeal branch passing back through the intervertebral orifice for innervating the membranes of the spinal cord. So, posterior branch of the spinal nerves. You may see on this picture 2 roots, anterior and posterior roots with ganglion spinale here, and also you may see the formation of cervical nerve and of a thoracic nerve, for example, and you may see the dorsal branch for deep muscles, autochtonic muscle of spine or dorsal. So let's in detail talk about dorsal branch. The posterior or dorsal branch of all spinal nerves pass backward between the transverse process of the vertebra, curving around their articular processes. With the exception of the first cervical, third, and 5th sacral and coccygeal branches, they are all divided into the medial branch, ramus medialis. You may see this branch here, and lateral branch. You may see it here. So lateral branch supply the skin of the back and head, the posterior surface of the neck and back, and the deep dorsal muscles. The posterior branch of the first cervical nerve is nervus subaccipitalis, and you may see this nerve here on this picture under my pointer. So nervus subaccipitalis does not give off branch to the skin. The posterior branch of the second cervical nerve, the greater occipital nerve, and you may see this nerve here, great occipital nerve, or nervus occipitalis minor, it's in Latin. It's coming out between the posterior arch of the atlas and the second vertebra, pierces the muscles, and having become subcutaneous, innervates the occipital part of the head. So, next, let's talk about anterior branch of the spinal nerve. So, the anterior branch of the spinal nerves innervate the skin and muscles of the ventral wall of the body and both pairs of limbs. Since the skin of the lower abdomen participates in the development of the external sexual organs, the skin covering them is also innervated by the anterior branches. Anterior branches of the spinal nerves preserve their original metametric structures only in thoracic segments. They formed nervi intercostalis, and the other segments connected with the limbs in whose development the segmentary character is lost, the nerves arising from the anterior spinal branch intertwine. This is how nervous plexuses are formed, in which exchange of fibers of different neurons takes place. A complex redistribution of fibers occurs in the plexuses. The anterior branch of every spinal nerve sends its fibers into several peripheral nerves, and each of them contains fibers of several segments of the spinal cord. It's therefore understandable that lesion of the nerve arising from the plexus is not attended by a disturbed function of all the muscles receiving innervation from the segments which gave origin to this nerve. So the cervical plexus, you may see it on this picture, is formed by the anterior branch of 4 superior cervical nerves from cervix first to cervix fourth, which are connected by 3 arching loops. You may see these loops here and also here and here, and located laterally on the transverse processes between the prevertebral muscles from the medial side and vertebral. So these muscles are following musculus scalenus medius, musculus levator scapulae, musculus splenius cervicis. So this plexus from lateral side anastomosing with the nervus accessorius, 11th pair of cranial nerves, and also with the hypoglossus nerve. You may see it here on this picture. In front of the plexus is covered by musculus sternocleidomastoideus. The branches arising from the plexus are divided into cutaneous, muscular, and mixed. The cutaneous branches are following. a lesser occipital nerve or nervus occipitalis minor. It goes to the skin of lateral part of the occipital region. The great auricular nerve, nervus auricularis magnus, you may see it here. The thickest nerve of the cutaneous branch of the cervical plexus passes to the canker auriculae, supplying it and the external acoustic meatus. You may see these nerves here. I repeat that all these cutaneous nerves contains only sensitive fibers, and they feeling pain, touch, and temperature. So next, third cutaneous nerve, you may see here nervus transversus colli, the transverse nerve, or anterior cutaneous nerve. So it goes to the middle part of anterior region of cervix and innervates skin of anterior part of cervix. And fourth sensitive or cutaneous nerve is supraclavicular nerves. You may see it's not one trunk, there are several, maybe 3, maybe 5 trunks of these nerves which go downside and innervate the lateral and inferior part of skin of neck. And you may see on this picture that all these 4 cutaneous nerves or skin nerves or sensitive nerves of cervical plexus go at the behind the posterior edge of sternocleidomastoid muscle and penetrate the fascia of neck at the level of middle third of sternocleidomastoid muscle. So I repeat, there are 4 sensitive cutaneous nerves which passes from cervical plexus, occipital minor nerve, greater auricular nerve, transverse neck, transverse colli nerve, and supraclavicular several nerves, 4 or 5 nerves. Next, we will talk about muscular nerves. So you may see these nerves here, and not these, only these nerves. Also, for example, you may see transverse colli nerve, and as I told you, this is sensitive nerve which innervates the skin of anterior part of neck here. So branches for muscle, two muscles for muscle for innervate cervical muscles, such are musculi recti, capitis anterior and lateralis, musculus longus colli and capitis, musculus caleni, and finally musculi intertransversali anterioris, go from these plexus, from cervical plexus. So also they formed 2 radix of other motor nerve, which called ansa cervicalis, or ansa, this is in English loop, cervical loop, and you may see this loop here. It forms from anterior or superior radix of plexus cervicalis and inferior radix from plexus cervicalis. And superior plexus is going from cervical first anterior radix and inferior radix form from cervical second, third, and sometimes fourth cervical anterior radix of cervical spinal nerves. And you may see this ansa cervicalis, and also you may see it here in this preparation, and this ansa gives branch for cervical muscles, for middle group of cervical muscles, such are omohyoidus muscle, sternohyoidus muscle, and also sternothyroidus muscle and thyrohyoidus muscles. For these muscles receive innervation from ansa cervicalis. And at last, we talk about mixed nerve, mixed branch. You may see one along mixed branch of cervical plexus. This nerve is called phrenic nerve. Phrenic nerve. Musculus phrenicus in Latin is diaphragm. So, phrenic nerve descends along musculus calenus anterior into the thoracic cavity, where it passes between the subclavian artery and vein. And you may see on this picture subclavian artery, and subclavian vein is cutted, but we can see in details phrenic nerve here. The right phrenic nerve descends really vertically in front of the root of the right lung and passes along the lateral surface of the pericardium to the diaphragm. The left phrenic nerve, you may see it here, crosses the anterior surface of the aortic arch and passes in front of the root of the left lung along the left lateral surface of the pericardium of the diaphragm. Both nerves pass in the anterior mediastinum between the pericardium and pleura. The phrenic nerve receives fibers from two inferior cervical ganglia of the sympathetic trunk. Phrenic nerve is mixed nerve. Its motor branches innervate the diaphragm, thus functioning as a nerve that is responsible for respiration. This is very important because you know that diaphragm is the main respiratory muscle, and after damaging of vertebra downside the fifth, sixth cervical segments, we have the patient has the paralyzation of all the muscles, of limbs, of trunk, but diaphragmatic or phrenical nerve continues its function to innervate the diaphragm muscle, and this patient can breathe with contraction of diaphragm after innervation of phrenic nerve from cervical plexus. It's very important for understanding, and also this is very important in emergency cases. Sensory nerves, it sends to pleura and pericardium. Some of the terminal branches of this nerve pass through the diaphragm into the abdominal cavity, and these nerves are called nervi phrenic abdominalis and anastomose with the sympathetic plexus of the diaphragm, sending small branches to the peritoneum, the hepatic ligaments, and to the liver itself. As a result, when liver is affected, a spatial phrenicus symptom may arise. There is information pointing to more extensive innervation by the Phrenic Nerves. It's presumed that with its fibers in the thoracic cavity it supplies the heart, lungs, the thymus gland, and in the peritoneal cavity it's connected with the solar plexus through which it innervates certain internal organs in abdominal cavity. So, next we talk about cranial nerves. You know that there are 12 pair of cranial nerves. First pair olfactorius, second opticus, third oculomotorius, fourth trochlearis, fifth trigeminus, sixth abducens, seventh facialis, eighth nervus vestibulocochlearis, ninth glossopharyngeus, 10th vagus, 11th accessorius, 12th hypoglossus. So we talked about the names of these nerves last term where we study cranial nerves in common anatomy of brain. And also I want to tell you that on this lecture we cannot in details talk about olfactory, opticus and vestibulocochlear nerves. There are first, second and eighth pairs, because we talked about these nerves when we studied the analyzators, olfactoric analyzator or smell analyzator, vision or optical analyzator, and also vestibular and hearing analyzator. We talked in details about these analyzators last term, and there was lecture about these, 2 lectures about these analyzators. In details we will talk about other nerves of these cranial nerves. So let's talk about these nerves, such are third, fourth and sixth pairs. So these nerves developed in association with cephalic myotomes, and for example you may see the cranial nerves here. You may see on this picture 4th pair. For example, you may see 2 nerves here, facial and vestibulocochlear nerve. Here you may see the trigeminal ganglion. You may see also this ganglion here. This is part of 5th pair of cranial nerves, trigeminal nerve. And also you may see the first branch of this nerve. This one is Ophthalmic nerve. Also you can see the 6th and 3rd pair, and also the 4th pair. So you may see the 4th trochlear nerve here too, and also you may see these pairs here. So you may see the trochlear nerve, 4th pair, 3rd pair. This one is Oculomotorious Nerve, and also you can see the part of 6th pair, Abducent Nerve. So Oculomotor Nerve, you may see it here, this one. Developmentally, the motor root of the first preaquillar myotome is the muscle nerve. It's mixed nerve it contains not only somatic muscle fibers, but also contains parasympathetic fibers. So efferent motor fibers arising from its motor nucleus and running to most of the extrinsic muscles of eyeball, and parasympathetic fibers running from the accessory nucleus to the intrinsic ocular muscles, musculus sphincter pupillae and musculus ciliaris. So you may see the nuclei of this third pair here. A red color you may see the motor nucleus, and in violet color you may see the parasympathetic accessory nucleus. So in this picture you may see this nerve, it arising from interpeduncular fossa of midbrain. Here you may see right and left nerves, and then they go to fissura orbitalis superior through it, and the fibers go to orbit and innervate more of the muscles of eyeball, such are musculus erectus oculi superior, musculus erectus oculi medialis, musculus erectus oculi inferior, musculus obliquus oculi inferior, and also musculus levator palpebrae superior. So the parasympathetic part form the oculomotor radix, which passes from inferior branch of this nerve, and then the fibers of this parasympathetic nucleus in violet color transmit to motor parasympathetic cells of autonomic parasympathetic nervous system in ciliary ganglion. I will show this ganglion later, but this ganglion is situated in orbit and contains the motor parasympathetic cells, which will innervate the internal eyeball muscles, smooth tissue muscles such are musculus sphincter pupillae and musculus ciliaris. Next pair is fourth pair and trochlear nerve. It's the same. Trochlear nerve is developmentally the motor root of the second preauricular. You may see the nucleus of this nerve. It's situated in posterior part of midbrain, and these fibers, the axons of central radix of this nucleus are crossed, you may see crossed on the opposite side of dorsal part of midbrain, and they arise from the surface of posterior part of midbrain behind the inferior calicos of quadrigeminum, dorsal part of midbrain. And you may see that crossing to the opposite side, and also they go over the trunk of midbrain, and next they pass into the inferior or superior orbital fissure to orbit. And next you may see that the fibers of this trochlear nerve are innervate the oblique superior muscle of eyeball. And next, oculomotor functional nerve. This is abducent nerve. So we have the different names of these three nerves: third pair, fourth pair, and sixth pair. Oculomotor, trochlear, and abducent nerve. But functionally, all these three pairs will innervate the muscles of eyeball, and functionally we can name them oculomotor nerves. But really, only third pair is called oculomotor nerve. So let's talk about abducent nerve. You may see this nerve, this nucleus here. You may see the facial caulicle, and this nucleus is situated in rhomboid fossa in this caulicle, facial caulicle, and the fibers of motor fibers of this nerve will pass between the pons and medulla oblongata here. I show you under my pointer, and then they go through the fissure, orbital superius or superior fissure, and they pass into orbit. And next they will innervate the musculus rectus lateralis oculi, lateral rect muscle of eyeball. So these three pairs, third, fourth, and sixth, are functionally oculomotor nerves. Next, let's talk about autonomic innervation of head. As I told you, the main difference between somatic and vegetative innervation is localization of motor nerves, of motor bodies of nerve cells. So the motors nerve cells of vegetative system, for example parasympathetic system, are situated in ganglia, and you must know about 5 ganglia in head, parasympathetic ganglia in head, ciliary ganglion, next pterygopalatine ganglion, next oticum ganglion, submandibular ganglion, and inconstant sublingual ganglion. There are 5 parasympathetic ganglion which contain the motor cells of parasympathetic vegetative nervous system. So the postganglionic fibers of these ganglia, they are motor axons, parasympathetic axons, which go to smooth muscle cell of organ in head. Next, preganglionic parasympathetic fibers. They are fibers from nucleus, from nuclei of 3rd, 7th, and 9th pairs of cranial nerves. And these axons or parasympathetic preganglionic fibers are transmitted in ganglia to motor parasympathetic cells. This is very important to understanding the vegetative features of nervous system. Next, sensitive cells. And you know that sensitive cells are also situated in peripheral part of nervous system and also in ganglia, but there are no connections in this ganglia. There are no synapses in this ganglia, and this featuring is very important between sensitive ganglia and parasympathetic ganglia. So, for example, you may see the trigeminal ganglion. Also, you may see the Glossopharyngeal, superior and inferior, and vagus, superior and inferior ganglia. All these ganglia contains sensitive pseudo-unipolar cells without synapses. And vegetative ganglia contains not only motor parasympathetic cells, there also contains the synapses between preganglionaric axons of nuclei and motor cells of parasympathetic system. And the principle of autonomic innervation is postganglionic sympathetic fibers from ganglion cervicalis superius. You may see this ganglion here, and you may see that this ganglion also contains the motor sympathetic cells, such parasympathetic cells in parasympathetic ganglia, but it's situated at the neck, and the the sympathetic postganglionic axons form the peripheral arterial plexuses, and these sympathetic fibers go over these arteries to head and neck structures, and also they innervate the smooth muscle cells in arteries and also in veins. You know that the middle tunic of artery and also vein contains the smooth muscle cells, and these sympathetic fibers will innervate the smooth muscle cells of these vessels, and also they go to peripheral organs in head and neck. And for example, some of these fibers will pass over the internal carotid artery next to the ophthalmic artery to the orbit, to eyeball, and sympathetic fibers will innervate the dilatator muscle of iris. Dilatator muscle of iris in eyeball. So you may see the nerves that passes through superior fissure into orbit. You may see the third, fourth, and sixth pair. All of these nerves, as I told you, are oculomotor nerves in function. But also you may see the first branch of trigeminal nerve, that's called ophthalmic nerve. So you may see the first, second, and third branch of trigeminal nerve. So let's talk about trigeminal nerve. It develops in association with the first visceral arch. It's mixed nerve. Its sensory fibers supply the skin of the face, the anterior part of the head, bordering posteriorly with the skin area, where the posterior branch of the cervical nerves of the branch of the cervical plexus are distributed. The cutaneous branch of the second cervical nerve reaches into the territory of the trigeminal nerve, thus creating a bordered zone of mixed innervation 3-4 cm in wide. The trigeminal nerve is also a conductor of the sensitive from the receptors of the mucous membranes of the mouth, nose, ear, and the conjunctiva of the eyes, except those parts of these organs which act as specific receptors of the senses. Innervate by first, second, seventh, eighth, and ninth pairs. So you must know that trigeminal nerve is called so because it has 3 branches. You may see first branch is ophthalmic nerve, second maxillary nerve, and third is mandibular nerve. So first and second branches, ophthalmic and maxillary nerves, are only sensitive, and they contain only sensitive fibers. But third branch of fifth pair of trigeminal nerve is mixed branch, and this branch contains also sensitive and also motor neurofibers. So let's in detail, first we'll talk about first branch. Ophthalmic nerve you may see this nerve in number 7. It passes into the orbit through the fissura orbitalis superior, and it divides into 3 branches there in orbit. First is lacrimal nerve, second is frontal nerve, and third is nasolacrimal nerve. Nasociliary nerve, frontal nerve, and lacrimal nerve. So frontal nerve passes directly forward under the roof of the orbit through the incisura supraorbitalis into the skin of the forehead, where it's known as supraorbital nerve. On its way, it gives rise to branch supplied to the skin of the upper eyelid to the middle angle of the eye. Next, lacrimal nerve, you may see number 5 here, passes to the lacrimal gland, and on passing through its ends in the skin and conjunctiva of the lateral angle of the eye. Prior to entering the gland, lacrimal nerve joins with the zygomatic nerve. So through this anastomosis, the lacrimal nerve receives secretory fibers for the lacrimal gland. But as I told you, this nerve contains only sensitive fibers. And third is nasociliary nerve. You may see it here, nasociliary nerve. Innervates the anterior part of the nasal cavity. Not here, anterior part of the nasal cavity here, you may see. With the nervate medalis anterior and posterior. Also eyeball. They are nervi ciliari longi for eyeball innervation, and also it innervates the conjunctiva. And I told you about ciliary ganglion. Ciliary ganglion lies at the posterior part of the orbit on the lateral side of the optic nerve. In this ganglion, which belongs to the vegetative nervous system, there is an interruption of the parasympathetic fibers running from accessory nucleus as a part of the third pair or oculomotor nerve through the smooth muscles of eye. So this ganglion contains the motor parasympathetic cells, but the axons from this ganglion pass with the sensitive fibers of ciliary longi nerves of first branch of trigeminal nerve, and these fibers form the short ciliary fibers. So short ciliary fibers contains not only sensitive fibers from trigeminal nerve, they contain also the parasympathetic motor fibers to ciliary muscle, smooth muscle cells of ciliary body, and also to sphincter pupil muscles. For example, you may see this ciliary ganglion here, and also you may see the fibers of first branch of trigeminal nerve. This is Lacrimal Nerve, and you may see how these fibers go to nasociliary nerve here. But in this picture you also can see the lacrimal nerve. This is one of three branches of ophthalmic nerve, which passes to lacrimal gland. Also on this picture you may see the frontal nerve, which forms the supraorbitale and frontalis branches for skin innervation of forehead. So next we talk about second branch of maxillary nerve. As I told you, this branch contains also sensitive fibers, dendrites, which goes from this area to ganglion. And trigeminal ganglion, you may see it here, contains the sensitive cells of trigeminal nerve. So maxillary nerve passes into foramen rotundum to pterygopalatine fossa, and you may see that the pterygopalatine ganglion is situated also here. This ganglion contains the parasympathetic motor cells, and these motor cells receive information from from vegetative nuclei of seventh pair, Intermedius nerve. So there are some branches of maxillary nerve. you may see first zygomatic nerve in number 19. It goes to the skin of cheek and the anterior part of the temporal region. It anastomosis with the lacrimal nerve. You may see this anastomosis here. This one is lacrimal nerve, and this one is zygomatic nerve. This is very important because the parasympathetic fibers from this pterygopalatine ganglion go over the sensitive fibers of trigeminal nerve of zygomatic nerve, and then it passes on this anastomosis, and next they passes to lacrimal gland to produce the tears in lacrimal gland. This is very important for understanding the tears production. Next, the maxillary nerve gives branches for teeth. You may see superior dental nerves. They form the plexus for superior teeth. You may see here, and you may see also the branch of this nerve, which is called infraorbital branch, and it passes into infraorbital canal of maxillary bone, and it arises with three branches: inferior palpebral branch, nasal and cutaneous branches, and superior labial branches for innervate the skin of the face. And these three branches which passes from this infraorbital nerve are called pes and serinus minor, small goose leg, pes and serinus minor. And also you may see that this infraorbital nerve gives branch for superior teeth, and also for a mucous tunic of maxillary sinus. And next you may see that maxillary nerve gives branch for posterior superior teeth, such are superior posterior alveolar branches. And next you may see the branch for nasal cavity. Here, nasal nerves. You may see details here. Nervi nasalis, posteriores lateralis for innervation, non-specific innervation of mucous tissue in nasal cavity, and also palatine nerves, which passes through the palatine canals to mucous tissue for sensitive innervation of mucous tissue of hard palatine and also molar palatine. So these trigeminal fibers contains only sensitive fibers, but the parasympathetic fibers of pterygopalatine ganglion passes together with these sensitive fibers of trigeminal nerve. So trigeminal fibers are innervate the sensitive non-specific innervation of mucous tunics, such are the mucous tunic of nasal cavity, of maxillary cavity, maxillary sinus, and also of tunic of hard palatine and molar palatine. But the glands of these tunics, its secretion to produce the mucus liquid are innervates from this ganglion. The fibers go together with the trigeminal sensitive fibers. So, sphenopalatine ganglion or pterygopalatine ganglion contains only vegetative parasympathetic cells, body of cells, which axons passes with the sensitive fibers of trigeminal nerve. And third pair is so you may see the innervate of hard palatine here, nasopalatine nerve, great palatine nerve, lesser palatine nerves. There are sensitive fibers of trigeminal nerve and also the fibers of pterygopalatine ganglion with the vegetative parasympathetic fibers. So the third branch of trigeminal nerve is mandibular nerve. So it contains, as I told you, two types of fibers, sensitive and motor fibers. So it passes here through ovale foramen of sphenoid bone, and it gives sensitive fibers in alveolar inferior nerve. This nerve passes into mandibular canal, and next it gives branches for inferior teeth of mandible, for gingiva, and also periodontum, connective tissue to fix teeth in their alveolus in mandible, and also it passes through the foramen, mental foramen, to the skin of mandible, to the inferior lips, and to superior part of neck skin. So this branch of mental nerve innervate the skin of this inferior part of head or face, and also the superior part of neck. Next, I want to tell you about lingual nerve. You may see this lingual nerve. It goes to tongue, into the tongue, and it will innervate the mucous tissue of tongue, non-specific innervation of two-third dorsal part of tongue. So this innervation has non-specific featuring to innervate the tongue, and we can feeling the temperature with our tongue, we can feeling the pain, and of course the touch. There is no specific gustation innervation. I want to repeat that trigeminal nerve has only non-specific innervation of tongue, non-gustation innervation, only common innervation such as pain, touch, or palpation, and also temperature. But you may see that gustation fibers from seventh pair of cranial nerves passes and confluence with the lingual part, lingual branch of trigeminal nerve. And also you may see another sensitive branch, buccal nerve or cheek nerve, which passes into mucous tissue of cheek and it innervates the sensitive non-specific innervation of mucous tissue of cheek. And at last you may see the auriculotemporalis nerve. It's also the sensitive nerve which passes to fascia, to joint, capsule of joint, and also it passes to parotid gland. It contains only sensitive fibers, but the fibers from the oticum ganglium, parasympathetic fibers, go together with this sensitive branch for motor parasympathetic innervation of parotid gland and also the glands, lesser glands of cheek. But this is very important for understanding the principle of innervation, because trigeminal nerve contains only sensitive fibers, but these fibers go with the parasympathetic fibers together from, for example here, from oticum ganglium, and oticum ganglion fibers are innervate the parasympathetic innervation of saliva glands to produce saliva. But sensitive fibers from trigeminal nerve will innervate only sensitive innervation, pain, touch, and also temperature. But most sensitive is the most sensitive is pain. So, as I told you, not only sensitive fibers passes from mandibular nerve. This nerve also contains motor fibers, and you may see temporal motor fibers, masticatory fibers for innervate temporal muscle, masseter muscle, for innervate pterygoid, medial and lateral muscle, and also the fibers go to muscles of pelvic floor, oral floor. You may see the fibers which passes to mylohyoid muscle, to anterior ventricle, anterior belly of digastric muscle, also to geniohyoid muscle. So the motor fibers also pass to musculus tensor veli palatine, tense muscle of vel palatine, and also to tensor muscle of tympanic membrane, musculus tensor tympani. These muscles are innervate with the motor branch of mandibular nerve of trigeminal nerve. So you can see that the lingual nerve, intertrigeminal nerve, passes with the parts of seventh pair of cranial nerves. This is a lingual branch of chorda tympani nerve, and it goes with lingual nerve or trigeminal nerve. But this nerve is called, I repeat, chorda tympani nerve, contains sensitive specific fibers for gustation. And you may see also that ganglion, which called submandibular ganglion, is situated with the fibers of lingual nerve. And postganglionic fibers, you may see here, passes with the fibers, sensitive fibers of lingual nerve to the tongue and also to sublingual tongue, sublingual gland and submandibular gland. So these cells, parasympathetic cells, will innervate these glands to produce saliva into oral cavity. But sensitive trigeminal fibers will innervate, sensitive innervate of these glands for feel pain, for example, after inflammation, and other sensitive sensation. So you may see on this picture oticum ganglion. You may see this ganglion here. And also here. Under live microscopy you may see it here. It's situated near of mandibular nerve, and also it contains the motor parasympathetic neurocells for innervation, salivatory parotid gland, and also lesser salivatory glands of cheek. Next, let's talk in details about seventh pair. This pair is called facial nerve, but in modern classification, the seventh pair includes two parts: facial nerve and intermedius nerve. So, as I showed you earlier, the facial nerve is passed through pons in pontocerebellar angle. Next, this nerve passes into facial canal of temporal bone. You must repeat temporal bone and all its canals. So the motor part of seventh pair is called facial nerve, and you may see the final parts of facial nerve, the branch of facial nerve, they called Pessenserinus Meyer. And you may see these nerves here. You may see the branch of this nerve. Temporal branch, zygomatic branch, buccal branch, mandibular branch, and cervical branch. All these branches contain the motor fibers to innervate mimic muscles and also epicranial muscles, and in cervical part, platysma muscle. So temporal branch, zygomatic branch, buccal branch for cheeks muscles, mimical muscles, mandibular branch, and cervical branch for platysma. So the motor fibers from facial nerves go to occipital bellies of epicranial muscle. Also they go to posterior belly of digastric muscle. One branch goes to stereohyoid muscle, and also inside the tympanic cavity, little branch go to little muscle, stapedius muscle, inside the tympanic cavity. So they are the motor somatic branch of facial nerve. But seventh pair also includes the Intermedius nerve, second part of seventh pair. And this Intermedius nerve contains sensitive and parasympathetic fibers. So this Intermedius nerve gives first branch, which called Great Petrosal Nerve. It contains only preganglionic parasympathetic fibers from superior salivatory nucleus in pons, and these fibers passes through this great petrosus nervus canal through the lacerum foramen to canal which called pterygoidus canal. And you may see that the preganglionic fibers of this nerve mixed with the confluence with the sympathetic postganglionic fibers with deep petrosus nerve or nervus petrosus profundus from plexus carotis internus. You may see that pterygoid canal nerve forms from preganglionic fibers of great petrosus nerve and from sympathetic postganglionic fibers of carotid nerve. So the preganglionic parasympathetic fibers go to pterygopalatine ganglion and transmit to pterygopalatine neurocells of parasympathetic nervous system. But sympathetic fibers passing transitory through this ganglion without transmitting and passes into smooth muscle cell of other organs. So second part of Intermedius nerve passes to through the facial canal, and it passes such chorda tympani nerve through chorda tympani canaliculus, and this chorda tympani nerve contains two parts: sensitive gustation part and gustation part, and second part paraganglionic part, parasympathetic preganglionic part. So you may see that this nerve passes outside the temporal bone through petrotympanic fissure, and it conflues with lingual nerve of trigeminal nerve. So after this part, this trunk, nervous trunk, contains non-specific neurofibers from trigeminal nerve, specific gustation fibers from chorda tympani nerve, and preganglionic neurofibers for transmission for motor parasympathetic neural cells of sublingual and submandibular ganglions for innervation glands, salivary glands, sublingual, submandibular glands, and also lesser gland of oral floor mucous tissue. So you may see the variations of duration of branch in facial nerve. You may see the plexiform features, and also you may see that one trunk of facial nerve passes through the parotid gland here, and next it divides into terminal branches. So next we talk about 9th and 10th pairs of cranial nerves. You may see that that 9th and 10th pairs, glossopharyngeal and vagus nerve, passes from medulla oblongata with radix, 5 maybe 6 pair of radix. Next they passes through the jugular foramen, and they form 2 sensitive ganglions, superior and inferior ganglions. So for example, you may see the superior and inferior ganglions of glossopharyngeal nerve and superior and inferior ganglions of vagus nerves. So the sensitive fibers of vagus superior ganglion passes through the mastoid canal to auricle for sensitive innervation of auricle, and also some fibers passes to meninx for sensitive innervation of meninges or couch of brain in fossa cranium posterior. So you know that glossopharyngeal and vagus nerves are mixed nerve. All of them contain 3 parts of fibers: parasympathetic fibers, sensitive fibers, and motor fibers. So first we talk about motor fibers of glossopharyngeal nerve, and you may see only one motor fiber of this nerve which innervate the muscle, stylo-pharyngeal muscle from styloid process. You may see, for example, here of temporal bone to pharynx. So these sensitive fibers of glossopharyngeal nerve take part in innervation, sensitive innervation of mucous tissue of pharynx, and also molum palatine, tonsils, palatine tonsils, and last 1/3 specific sensation of tongue, specific gustation of tongue, 1/3, back 1/3, and you may see schematically the innervation of glossopharyngeal nerve. And also you may see the sensitive and parasympathetic fibers which passes from inferior ganglion to tympanic cavity in tympanic nerve. This tympanic nerve will innervate the tympanic mucous tissue, sensitive innervation, and also parasympathetic autonomic innervation for produce mucous liquid. And after this innervation, only preganglionic parasympathetic fibers passes through hiatus nervi pitosis minoris, they form this nerve, minor petrosus nerve, which passes through fissura petra squamosa to oticum ganglion, and they transmit to motor cells of otic ganglion. And next, you know that postganglionic fibers passes with trigeminal fibers to mucous tissue of cheek and also to parotic saliva gland. So you may see also that one of sensitive branch of glossopharyngeal nerve passes to carotid glomus in bifurcation of common carotid artery to internal and external carotid arteries. And you may see this nerve, herring nerve here, sensitive nerve of glossopharyngeal nerve. Vagus nerve has 4 parts for innervation. In cranial parts, as I told you, it innervates the meninx and auricles. Also, it gives branch for pharynx. It forms the pharyngeal plexus, and you may see the motor innervation of pharyngeal plexus, pharyngeal muscles, constrictors muscles, superior, medial, inferior constrictor. Also, vagus nerve gives motor branch for muscles of mole, palatine, for levator, palatine, musculus levator veli palatini, for aval, palatine muscle, for musculus palatopharyngeus and musculus palatoglossus. But as you remember, as I told you, only one muscle of molum palatine innervates via trigeminal nerve. This is tensor veli palatine muscle. So this one muscle of molum palatine innervates via trigeminal nerve, but other 4 muscles, such as uvula muscle, levator veli palatine muscle, palatoglossus, palatopharyngeus, innervate via vagus nerve. So in cervical part, it also continue to innervate the pharyngeal skeletal muscles. It gives pharyngeal nerves. Also, it innervates the esophagus skeletal muscles. You know that esophagus in superior parts has skeletal muscles, and these skeletal muscles also in cervical part and also in thoracic part will innervate via vagus nerve, but in thoracic part it will be thoracic part of vagus. And next, the motor fibers of vagus passes to larynx via superior and inferior or recurrence vagus nerves. But you must know that recurrence vagus nerve from right side passes through over the subclavian artery, is go around subclavian artery and returns to larynx, but in left side the vagus return laryngeus nerve passes over aorta, you may see it here, and returns to cervix and innervates the laryngeal muscle. So this is very important for understanding the laryngeal muscles, because larynx is the main organ that produces the voice, the sound for our speech and talking. And these recurrence vagal nerves very important for innervation vagal muscle in larynx. So there were the motor fibers of vagus. But you know that vagus also contains the sensitive fibers for sensitive innervation of larynx, pharynx. It takes part in sensitive innervation of pharynx with glossopharyngeal nerve, and also it takes part in a sensitive non-specific innervation of larynx and one third, posterior third of tongue. Non-specific innervation, I repeat that there is temperature, touch, and also the pain. So thoracic part of vagus also contains the parasympathetic fibers and sensitive fibers for innervation internal organs, lungs, heart, and also abdominal part of vagus takes part in innervation of internal abdominal organs. It takes part for formation plexuses, abdominal plexuses, vegetative plexuses for innervation internal organ. So the sensitive part of vagus and also parasympathetic part of vagus will innervate the abdominal organs since esophagus till sigmoid column of intestine. You may see the laryngeal nerves, superior and inferior laryngeal nerves of vagus. On this picture, you may see the accessory nerve. This is 11th pair. This is motor nerve. It forms by two radix, cranial radix and spinal radix. They confluence in one trunk, and they also passes through jugular foramen with vagus and glossopharyngeal nerve. And you may see that one of connective branch passes into vagus to confluence with vagus, but other branch goes to muscles of neck, and it innervates mainly two muscles on the neck, sternocleidomastoidus muscle first and trapezoid muscle next. You may see two of these muscles here. And at last, let's talk about hypoglossus nerve. Hypoglossus nerve. This is 12th pair. So this nerve is motor. It contains only motor fibers. It passes through anterior lateral groove of oblongate medulla. Next is go to hypoglossus canal of occipital bone, and this nerve gives motor branch for all the muscles of tongue, for proprial muscles and also for skeletal muscles. For example, you may see genioglossus muscles, here glossus muscles, so some part of palatoglossus muscles, also for muscles, proprial muscles, longitudinal muscles, vertical muscles, and transverse muscles. All these tongue muscles are innervate via hypoglossus nerve. And also you may see that it forms the connection with superior radix of cervical loop, ansa cervicalis, for innervation the muscles of neck. And next, let's talk about some words about sympathetic trunk. I told you that sympathetic trunk is pair morphologic construction, which situated laterally of vertebral column, and at the cervical part it has three ganglia. The biggest ganglia is superior cervical ganglia. Next there is inconstant medial ganglion and also inferior or stellar ganglion. So you may see that postganglionic fibers, sympathetic fibers, form the periarterial and also perivenosous plexuses, sympathetic plexuses, and over the arteries they pass to the organs of head and neck, and also they innervate the smooth muscle cell inside the walls of arteries and also in veins. So I know that there is very difficult to understand the innervation, but I think if you in details look my lecture and listen very detailedly, you will understand this difficult part in anatomy. Thank you for your attention. I wish you all the best. Goodbye, see you again.